Opinions expressed on this show by Dr. Del Campo are solely her own. Her opinions should not be taken as medical advice. It is strongly recommended you consult with your own doctor before undergoing any cosmetic or dermatological treatments.
Welcome to DermTalk with Dr. Roberta, and I'm Dr. Roberta Del Campo, and I am sitting next to my husband, Henry Del Campo, and I'm excited to talk to you today about lasers and energy-based devices, my favorite topic because this is an area that I absolutely love and that I focus my practice on, and I'm also going to give you a deep dive into how I chose dermatology, how I specifically got into aesthetics, and what treatments I like in my office.
So, it's our first podcast together. It's pretty cool, huh?
It is. It's going to be an interesting experience, to say the least, but a lot of fun.
Yeah, I think so.
Something for the memory books.
So, I think it's amazing. You were amazing, and you came up with this idea of doing a podcast. So, love to hear.
It comes from my patients. I mean, for years, they've been telling me, you need to do a podcast. We love hearing you speak. You're so educated. You have so much knowledge, and you're easy to talk to. And I think what they always tell me is that I can bring it down a level so that everyone understands it. And so I thought this was not only going to be fun, but a way to give back to my patients and to people who really want to learn more about skin and beauty. And, I think this really is the wave of the future. I mean, this is something that everyone loves and really puts a lot of energy into. Think about like Instagram, social media, Twitter, TikTok. A lot of it's about beauty.
Yeah, it is. And look, I think it's a great opportunity, right? Your patients have 30 minutes with you, an hour with you, and sometimes less. So I think this is a great opportunity for them to understand you a little bit more and get to know you a little bit more. And I've always I'm your biggest fan, being your husband, but I think this is going to be fantastic and really just a great way, a great avenue for you to get closer to your patients, stakeholders, folks that deal with you on a day-to-day basis, and I think this is going to be a lot of fun.
Well, I'm excited.
Cool.
So let's go.
Awesome. So let's start. So look, I've known you for a long time, right? But I think one of the things that makes you so special is your background, kind of going all the way back to Dr. Roberta, the young days, right? Let the audience know kind of what triggered you to even think about dermatology, if we go all the way back, and then kind of the road that pursued after that, right? You went through medical school, you went through residency. I was with you for a long period of time during that period, specifically on the residency side, but a lot of trials and tribulations. So would love to hear from you in terms of kind of how that all progressed.
Yeah. Well, oh my gosh, and actually this is like an emotional piece for me, just thinking about why I even became a doctor. As Henry knows and went through the passing of my mom, she had a liver disease since I was, a little girl, and I constantly was going to doctor's appointments with her. I saw how much the doctors tried and did help her. And so I would say from about age 10, 11 is when I knew I wanted to be a physician, a doctor. That was step number one. So I started really focusing, even at that age, on science. I realized I was really good at that. And then fast forward in college, I started thinking about what I wanted to do within medicine. And I was lucky enough to have some contacts in the world of dermatology and orthopedic surgery. So I was able to really dip my toes in different specialties and realize that dermatology was really where I wanted to be. A lot of that came to with my personal experience having melasma since I was about 15, 16 years old. So I was essentially, and I tell my patients this almost on a daily basis because I have so many patients that have melasma, but I was covered, I would say 60% of my face at one point. I had dark brown patches on my face. I was very insecure. I would cover it with thick makeup. Obviously, when I played tennis, and I played tennis in college, I couldn't wear makeup, and that was a time that I felt the most insecure. And I realized that it was a changing point for me to really want to bring confidence and, and really improve people's skin. So it went from being a doctor to dealing with my own skin concerns, something that made me very insecure, to deciding I wanted to do dermatology.
Yeah.
And then obviously as well, I just realized it was a good fit for me. I've always had an eye for beauty. I've always been obsessed with skin. I mean, I used to use Estee Lauder, which was my favorite brand growing up when I was, 13, 14, 15 years old, because that was the infatuation of my mom and my grandmother as well. And so from there, everything just moved forward. I went to medical school at Boston University. I selected that program because it was a top 25 program for medical school. And then from there, I was lucky enough to land a top 3 dermatology program, University of Michigan. I'm proud to say that. It was a phenomenal program. I learned a lot. We worked hard. It was considered one of the most difficult dermatology programs in the country, but I learned a lot. And from there, went into a fellowship in aesthetics. It was an interesting way that I kind of stepped in, because it was the first year the University of Michigan decided to start a fellowship in aesthetics. It was a newer specialty within the world of dermatology. And so I was actually the first fellow that graduated from that program. And we really focused on lasers, energy-based devices, and obviously injectables. So that was kind of my road into aesthetics. And, I am where I am today because of the programs that I chose, my personal life experiences, and just, I think, that natural desire to really help people feel confident and feel their best.
Yeah, that's great. And going back to melasma, a lot of that was exacerbated. You mentioned you played a lot of tennis.
And
a lot of that was exacerbated because of the sun exposure at that period of time, right?
Absolutely.
Yeah.
Yeah, melasma is typically triggered more by heat, sun exposure. A lot of it's genetics as well. But we know specifically in Florida, and that's why I have such a strong following in my clinic for melasma and for pigmentation, because it's so common down here.
Yeah.
And I think it's also so personal. When patients of mine hear my story, a lot of times that's what drives them in to see me. And I post a lot about that on my social media. I'm very open about the fact that I haven't always had perfect skin. Everyone looks at me, they're like, your skin's perfect. You're so lucky. And I said, well, it's been a journey. It's been a road to get here. I know what to do because of my expertise, but I was born with great skin, but it wasn't my whole life. So that's an area that I really have a strong passion for. And that's what kind of draws a lot of my clients in, specifically because of the heat and the sun and active lifestyles down here.
Yeah, that's great. So I think that's a good segue to the topic that we're going to be covering today, which is lasers and energy-based devices, right? And I think, as you think about melasma and other skin concerns, lasers and energy-based devices, I think, are perfect, kind of really treatment for a lot of those issues. Why would one patient prefer one over the other? Mm-hmm. Clearly, you're the doctor; you would always have the recommendation and the diagnosis. But how do you approach that?
I think in simple terms, lasers tend to be more for color imperfections, red, brown. They can resurface the skin as well. But really, the way lasers work is they use a specific wavelength, so a laser energy, to penetrate through the skin, produce heat in the skin, and attack what we call different chromophores. And there are 3 main chromophores in the skin. One is melanin, which equals pigmentation. The second is hemoglobin, which equals redness and blood vessels. And the third is water, which equals texture, brightness, and overall health and quality of the skin. So lasers are really developed, if you will, to treat specific concerns, whether it's red, brown, texture, brightness, and they do it in a very direct way. And that's why it's important to really approach your provider and let them know what bothers you the most, because then they can pick the best laser device for you. Energy-based devices are a bit different because we're not using a specific wavelength of energy. We're just using heat, or we're using something like ultrasound, radiofrequency. But it's an overall kind of general term for energy-based devices that do not house lasers. So they're a little bit different, but they work in conjunction. They work hand in hand. Energy-based devices aren't as popular when it comes to pigmentation or redness in the skin, but rather more tightening, collagen stimulation, smoothing of the skin. And most providers will combine those type of devices to give you the ultimate outcome.
So both are effectively using heat. In one way,
just
shape,
different
or
ways.
form.
Mainly, they're energy-based devices, not to make it too confusing, such as microneedling, that uses mechanical wounding to the skin.
Yep.
But in general, energy-based devices tend to be more like the big, hot topic really is radiofrequency and ultrasound.
Mm-hmm.
And then we have things like microneedling as well, but that doesn't use heat.
Yeah. Great.
I know it gets a little trying to make it simple, but this is the reason I did a fellowship. I will tell you that. This is why I specialized in this, because even, finishing my dermatology training, textbook, you look at different wavelengths, 1064, 808, 910. I mean, there are different wavelengths that we can think about, but really understanding them can get very complicated.
Yep.
And, being in a situation where various companies and reps are knocking at my door every day saying they have the best device on the market, because everyone, of course, does. It's important as a provider to know really what is efficacious, what is safest for your patient, and what is ultimately going to be the best product for your practice.
Yep. No, look, I think you bring up a great point, especially around, so you're here, you've been a dermatologist here in Miami for a really long time. Miami's different than other markets, right? I think you bring up a great point. Devices that you own may be totally different than a dermatologist in New York.
Absolutely.
Maybe totally different than a dermatologist in San Francisco. So I know you've done a lot of work around this, especially with various pharmaceutical companies, manufacturers, et cetera. I'd love to get a little bit of detail in terms of what your thoughts are around kind of what made you think about, okay, these are the devices that I'm going to implement in my practice in Miami. And, it could be totally different than a doctor somewhere else, right?
Yeah. So when I was building my practice, and you went through this with me, trying to figure out what devices to bring in, what my business model was going to be, I really had to think about what I wanted for my patients. And number one is I wanted inclusivity. I wanted to be able to treat the blackest of skin, the whitest of skin, the tannest of skin, the most sensitive skin, the most resilient skin. I wanted to be able to offer treatments that this device is safe on everyone. I also wanted to offer treatments that had minimal to no downtime. We live in Miami. Everybody has a fast lifestyle. They don't want to be out for a week, 2 weeks, a month after a procedure. So I really looked at advancements in technology to offer minimal to no downtime. I wanted treatments that were very comfortable. I can't say that every treatment I offer is painless, but I'm a big believer in patient comfort. So I looked at devices that were comfortable for patients, and I wanted devices that could be layered.
Yeah.
I'm a big believer in combination therapies, 1, 2, 3, 4 treatments a day stacked to really give the ultimate outcome. So this is, though, going back to, you have to have the knowledge. And sometimes I think I don't really understand how some of these, clinics that have someone who's just a businessman, nothing against businessmen, that's what you do, but how they would know what to buy. And I've heard that a lot of these places fail, or they don't have the optimal treatments because they just buy what a rep tells them is going to be the best for them. And we have to understand that knowledge is power, and you have to understand the technology that's out there, what different wavelengths mean, what's going to best fit your clientele.
Yeah. I think you make a great point on the fact that you've built your business a lot around minimal downtime, because especially here in Miami, I mean, you got folks coming to you all the time saying, hey, I got a major event this weekend. Would love to do X, Y, Z, but not always is that the best choice. Not always is that the best treatment, but I think you've done a good job of really selecting the corresponding treatments, equipment that addresses, concerns around extensive downtime. Of course, if you need to be aggressive on a particular treatment, I think you have the ability. But I think I've heard many times where, hey, unfortunately, I don't have this particular device. You need this particular treatment, and you've had to refer elsewhere, right? Because it's far and few between, but it does happen, I think.
For sure. I mean, like tattoo removal, I don't do tattoo removal. I just don't have the clientele that it was a wise investment for me.
Yeah.
To purchase something called a Q-switch laser for tattoo removals. I do treat sunspots, but somebody who has specific type of sunspots that maybe want them erased completely, there are different devices out there for that, but they offer a significant amount of downtime. So yes, I would say probably in the last 10 years, I've referred out maybe a dozen patients, because majority of my patients come to me because they know my business model. And, I do have devices that essentially treat 99% of what patients want or need in a way that's efficacious, safe, and with minimal downtime.
What are some standouts on the laser side? What are some standouts on the energy basis side? What are you seeing that you are implementing more in your practice?
I would say the number one laser standout, and it's a traditional type of wavelength. It's a 1064, a long pulsed YAG. It is my favorite wavelength because it is the deepest penetrating wavelength, meaning it bypasses the top layer of skin, allowing it to be the safest, while also being efficacious for all three chromophores. So it treats red, it treats brown, it treats brightness and texture and tone of the skin, but it does it in a way that's safe for all skin tones and throughout the entire year. What's also interesting with this type of technology is because it bypasses that top layer of skin, there is no downtime with this device, and it's virtually painless because a lot of these devices that attack the top layer of skin or the upper dermis, that's where a lot of these nerve endings live, making it more uncomfortable. So this is like the premier wavelength in terms of ability to treat pretty much everything under the sun, in a way that's virtually painless, that has no downtime, and that is safe for all skin tones throughout the year. So that was the first device that I bought for my practice. And, there are many brands out there. I love the Airlays Neo Elite just because it is a device that is really the most data driven. And it's a device that I've had for now almost 6 years with a strong patient following. So this is a device that I think really stands out from all the others. Yeah, energy-based devices, Ulthera, hands down.
And I think the Aerolace was maybe the first device that you purchased,
yeah,
right?
That's what I was mentioning. Yeah, it was the first one that I bought. And I, frankly, the story, I kind of bought it for myself because it's the only FDA-approved device that treats melasma, helps reduce the recurrence of melasma. And I saw an immediate improvement with my first treatment, and I basically signed the contract that day.
Yeah, I think I remember that.
Yeah. Wrote a check.
Yeah.
Bring it on.
Yeah, there you go. So, and on the energy-based device side, is there one that is a standout for you?
Ulthera.
Yeah.
Hands down. My passion for Ulthera, hence why I'm very heavily now involved with the company. It really came organically. It was my third device that I purchased for my practice. And it was a device that I wanted so badly for many years. And when I opened my own practice, it was a device that I said, this is what I have to buy as a next step. What I love about Ulthera is it is a game changer in terms of lifting and contouring. And it stands out because it builds elasticity in the skin. There's so many devices out there that build collagen, which this does as well. But what makes it unique is the elasticity. So it tightens and firms and lifts the skin. It does it with no downtime, and it's one treatment per year. So most of these other devices, you're doing 4, 6, 10 treatments. With one treatment per year, you can really change the contour and the quality of your skin.
Yeah, I've done that treatment myself.
Multiple times.
I'm a big fan of it. You definitely have to do the Pronox, right? I recommend that.
The laughing gas, yes.
It's
yes, that does help.
Yeah, you have to. I don't know. I don't have the best pain tolerance. I know other people do, but
You're not so bad. You've gotten better.
Yeah, I've gotten better.
Yeah, you've gotten better.
But if I am going to do the Ulthera, I'll go ahead and have a heavy dose of Pronox.
Look, at the end of the day, I think as providers, we should find ways to make less comfortable procedures more comfortable.
Yeah.
And that's just a trick. I mean, I'm a big believer in investing in technologies like Pronox to make the patient experience better, because ultimately, if you're uncomfortable, you hate it, you're not going to come back and you're not going to do it again.
Right.
So my goal is to offer you a treatment that might not be the most comfortable and make it more, more easy for you.
I do think it's tremendously efficacious, especially for me, right? I think genetically I have certain areas where not tremendously. Yeah, it could be better, right? But no, I do think the therapy is just really does wonders, especially in certain areas.
What we should point out, because what he's mentioning, and of course, everyone has areas that they want to work on. I mean, it's genetics. Mine is my under eye area. My mom had, her under eyes done at 40. For you, it's really the jawline, under the neck. An area that that you see on your dad, and you wanted to get a step ahead on that. And I think at the end of the day, everyone has to do what makes them feel their best. Yep. And so, I mean, obviously, I think you're extremely handsome and you don't need anything, but you're right. I mean, it's an area that you mentioned that you wanted to be a step ahead. And I fully support that as not only your wife, but your provider.
Yeah. And look, I think a great thing about it is it is true. I feel definitely efficacious. Don't have to do it once a month or anything like that. It's once a year, you get it done. What is it? Maybe 45 minutes?
Yeah,
50
an
minutes?
hour.
So
I mean, It's a game changer.
It is.
And I think what patients love too, and one thing I didn't mention earlier, is the devices also that I've invested in, the way that I approach my practice is really about natural looking results and actually improving skin health. Ulthera gives you a natural enhancement by lifting the cheek, lifting the jawline, tightening and firming the skin, and it doesn't change how you look. Yes, there are providers out there that they are successful because they want to change, and make somebody look different. I draw a crowd, and what I'm most proud of and the way that I really focus my patients and my practice is to make you just look more refreshed, make you look like you, but X number of years ago, and really improve overall skin health and quality. But I'm not looking to change you because I believe everybody has a unique look and they have their own sense of beauty. It's really just about making somebody feel more confident. Thanks for joining us on DermTalk. I'm Dr. Del Campo. Please like this video and subscribe to our channel. Next week, we'll be discussing trends in dermatology and injectable treatments.